Hello, you all. Nurse Lala here with MedSearch Nursing LLC, and I am here to go over a few NCLEX tips with you all. So the other day, I posted a question on my Instagram, and I posted it on TikTok as well. And so after 200 views on TikTok, I only had one response. And then I had no response on Instagram. But I did a poll on my Instagram story asking, should I do a YouTube video to explain this question? And I got one vote, and the vote was for yes. And so here I am. So thank that student who was brave enough to respond on TikTok and then brave enough to answer the poll saying that they would like some direction on this question. All right, so let's go over a couple of tips that I want to remind you of before we get to the question. All right, so several of you may already have some healthcare experience, whether it be as a patient care tech, it may be as a CNA at a long-term care facility or rehab facility. It may be something, you know, in your family that you've been around as far as healthcare related information and procedures, you know, involving family members. So you have some degree of background. But what I want to remind you of is that when we have those type of experiences, they are good. Great experiences, don't forget them, but don't bring them into your question, okay? Sometimes those experiences cause students to create their own scenario, and then they try to frame the question and answer it based on what happened with this particular person or during this particular event, okay? So you know this is textbook. All right. You know, the clinical setting is completely different, but you're answering questions textbook fashion. All right. NCLEX fashion. Okay. So you're going to make your decisions based on only what you see in the question. If you get to a point to where you find yourself saying, what if? I want you to stop yourself immediately. Okay. Because I don't want you to go down that path and start creating your own scenarios. All right. And as you know, if you're in nursing school, you know, all of the answers can be correct, but you have to pick the best answer. Okay. You're going to choose the priority answer. So even if both of them or all of them are correct, which one is the priority? And when we think of priority, there's several different frameworks, but the most common one is our ABCs. Okay. All right, so let's get to the question. All right, the $1 million question here. The patient has been NPO for 24 hours, but now has new orders for FiberSource HN continuous infusion via nasogastric tube. The goal rate is 60 milliliters an hour. What is the nurse's highest priority before beginning the feeding? Should the nurse obtain the baseline weight, assess for crackles in the lungs, listen for air bolus with the stethoscope, ensure the head of the bed is 90 degrees, or should the nurse initiate the nutrition consult? What should she do as the highest priority? So let's analyze our options here. Is getting a baseline weight a good idea? I think so. I think we can agree that that's a good idea. The patients probably had a weight done in the ER or when they were admitted to the floor. Is it a high priority? Not so much. It's not the highest priority. Of course, weight could be important in terms of if the patient has a history of CHF, and, you know, we need to monitor these patients' daily weight to see if they're, gaining more than 2 pounds. that's when that will most definitely be important. But we don't have any information about this patient's history, so we're not going to assume that they're a CHF patient, right? We're not going to create our own scenario. So getting a weight is a baseline good idea, because it's also important because we want to make sure our patients get proper nutrition. So monitoring their weight will be a good idea so that we can know whether they're getting sufficient calories and nutrition, okay? Because we don't want them wasting away, okay? You can't heal without improper nutrition. So the weight, again, is a good idea, but I wouldn't say it's a high priority. Let's go through the other ones. So is assessment of the lungs necessary in order to start tube feedings? Let's read that again. Is assessment of the lungs necessary in order to start tube feeding? No, it is not. As much as it's respiratory related, that's not standard protocol to listen to the lungs. Now, you're going to listen to the patient's lungs for your basic nursing assessment, but that's not a requirement prior to starting tube feeding, okay? Let's see, option 3, is listening for air required prior to starting tube feeding? Absolutely. You have to check placement. Is this a priority? You bet it is. Why? It can become an airway issue, because if the tube is not in the right place, the only other place it can go is in the lungs. So we'll be infusing tube feeds down a tube directly into the patient's lungs. So it won't take long for this patient to start developing respiratory changes and end up with aspiration and pneumonia. All right. So is keeping the head of the bed 90 degrees necessary prior to starting the tube feeds? Think about that really closely. Is keeping the head of the bed 90 degrees necessary prior to starting feeding? Nope. Standard protocol is at least 30 degrees, right? Right. So 90 degrees, you need a patient sitting up if you're getting ready to place a tube, but that's not what we're doing here. We're getting ready to start feeding. And so we teach our students, in test review, if you have an order to give some medication, even though it doesn't say the patient has a right 20 gauge in the AC, the patient has an IV, okay? You just base your judgment on whether you can give the medicine, is it safe and appropriate, okay? So this patient has an NG tube already, all right? So we're not starting one, we're starting the feedings. So is keeping the head of the bed a priority during feedings? Yes. Protocol 30 degrees, 90 degrees is not required, okay? Also, 90 degrees will be uncomfortable for you and me if we set up like that all day getting feedings and not move, okay? Also, sitting 90 degrees put extra pressure on the sacrum area, so that's not a good idea. That's why they encourage about 30, no more than 45 degrees with the tube feeds, okay? So that we're not putting pressure on the patient's sacrum and then contributing to skin breakdown. All right. So head of the bed is a priority, because if we, again, don't have the bed up high enough, the feedings could go into the patient's lungs. This patient could aspirate, end up with pneumonia and in respiratory distress. So we could have an airway issue with this one as well. All right. Option E is initiating a nutrition consult a good idea? Yep, it's a good idea. Is it the highest priority for the nurse to do in order to start the feedings? No, I wouldn't think so. In fact, once the feedings are started and the nurse is down the chart, At that point, she can do the nutrition consult, okay? That's not the highest priority. Again, when we think about priority, we think about one of our priority frameworks, and ABCs is going to be the most common one to think about when you're deciding what's priority with your NCLEX answers here. Okay, so I think after analyzing these, we can safely say that we can automatically eliminate option A, B, and E. And we're stuck with C and D because they both can contribute to respiratory distress and airway issue. So again, do we have to have the bed up at 90 degrees prior to feedings? The answer is no. Do we need to keep the head of the bed up during feedings? The answer is yes. Is listening for air required prior to starting the feedings? Absolutely yes. Is this a priority? Yes. Yes and yes. I think we can safely eliminate option D, and so option C would be the best answer. It is important for the nurse to listen for air prior to starting the feedings, okay? This is the highest priority for the nurse to do. If the nurse does not check placement and only starts the feedings with the patient elevated 30 degrees or 90 degrees and that tube is in the wrong spot, it's not doing that patient any good, okay? So hopefully you have a better understanding of that particular question. If there's any other questions that you have about it, I have created a Facebook nursing student community under MedSearch Nursing LLC. Head over, join, just send me a quick invite. I'll let you in. It's only a closed group because I just want to have, close monitoring and make sure that it's only nursing students that are a part of this. And so just shoot me an invite. I'll let you in. And this is a safe forum where you can actually ask me questions related to nursing school content of any kind, and I'll be happy to answer. As you all know, I'm back in acute care full-time, and I have a part-time position with an NCLEX review faculty, but I've not done that all last year. So I've not been in the classroom setting in quite some time. And so this gives me something to do because I really do love student contact and I miss it so much. And so anyways, thank you all for joining me. Also, if you're not following me on Instagram, I'm on there, MedSearch Nursing LLC. Make sure you're subscribed here to YouTube. If you're on TikTok, I'm nurse.lala over there. All right. So thanks for joining me. I hope it was helpful. I do want your feedback as well. I don't always want to be the one talking and communicating. I do believe communicating is a two-way street. So let me know, was this helpful for you? What you think about those rationales and how we talk through it. Okay. All right. So that's all for now. As always, keep saving lives and being great. Bye.